Well, hi, folks. Safe to say that our minds might be occupied by a certain event going on right now. We might not be thinking so much about COVID-19 that is still very much here in Cobb County and the state of Georgia. So we talked with the director of Cobb and Douglas Public Health, Dr. Janet Memark, once again today, who tells us, unfortunately, those cases keep rising.
When we're taking a look at our numbers and the trends over the last few weeks, we're seeing a steady increase. And so Cobb is up to, from last night, 171 cases per 100,000. And just to remind everybody, anything over 100 is considered high transmission. And so for those of you that are watching things other than the election, we know that there's a surge that's happening throughout the nation, and so we have a lot of cases, and we keep breaking daily records on COVID-19 cases throughout the country. We want to hope that Georgia and Cobb County are immune to that, but unfortunately we're not seeing that. So we are seeing a rise throughout the state of Georgia, and throughout the state overall there is an increase in hospitalizations. So Cobb is kind of following suit with the number of cases right now, and so heading up in that direction.
So public health folks like to look for trends, and in this case when they look at COVID-19 in Cobb County, it's not really who, but how COVID is spreading.
The way that it's spread out is, pretty evenly around the ages. We do have younger folks that are being infected. We continue to have a few deaths that continue to come through. Our only guess right now is that, when you're surrounded by areas that have a lot of transmission and surges going on, you really have to be kind of on your best kind of prevention behavior to keep that from coming in. And so I don't know what you all have been seeing, but I have seen some laxity in the use of masks and of physical distancing and things of that sort. And so I'm a little bit concerned that we're getting a little tired of this, and so we're leaving windows and doors open for COVID-19 to come into our community.
Well, the weather is perfect right now, and it should be a good weekend, but we're entering the time where everybody's going to be kind of cooped up inside. Temperatures are going to be going down. We're going to be cranking up the heaters. That could lead to surges, and that's what public health is already seeing, especially surges in groups that have to hang out together.
This is a perfect storm of activity right now. So we're going into colder weather, which forces people to go indoors and where it's less ventilated. So that's one factor. We're entering into a travel season as well. And so we're going to have a lot of mixing throughout the nation. I know people have not seen their family members in close to a year. And so this is a time where I know people want to see each other. And we're having surges. And so you can look at the national trends of surges, but also even within Georgia, you can see there are certain areas, even in the Northwest District in Georgia, we are having much higher rates than we have here. So when you can look at your microcosm of Georgia, and if you have family members coming in, these are things to consider if they're coming from very, very high transmission areas and different areas of the country as well. There's some places that are not as affected, but there are definitely places that have much higher levels and will put us at risk.
All right, so what to do? We all want to spend the holidays together, but we're not necessarily saying you have to do Thanksgiving by Zoom, but you do have to think about what you're doing.
Well, I know people want to see their families. I'm going to be seeing my family too, and so we're trying to do a bit of a pseudo quarantine and making sure that everybody is trying to be on their very best behavior before they travel. So trying to be in a pseudo quarantine where you're trying to not go out as much, make sure you're wearing those masks and distancing and as much activity as you can, avoid any sort of crowds. And if you can get tested before, then that is actually another good prevention tool you can do.
And what about that COVID-19 vaccine? How are we doing on it? When can we expect it? And when it arrives, who will get it?
We have a few updates on the COVID-19 vaccine. So right now we're hearing that 2 vaccines are well on their way to completing their FDA approvals. So we have the one that will be at the end of November, beginning of December, and a second one at the end of December. So I just want to remind everybody that the first batches will be smaller batches that will be coming out. The most prioritized people right now will be our healthcare workers, and then nursing home residents and staff. And then we have our frontline workers of public safety and such that will be in that bottom top tier. So once those first vaccines get out, the wave of next batches coming out will be exponential. So we anticipate having many, many more doses, millions that will be coming down the pipeline. So public health obviously will have some involvement, but the way it kind of works is that there are what are called pods or point of distribution that are throughout our district and county. So for example, the Wellstar Health System is their own internal pod, so they will have vaccines shipped to them to take care of their folks and family. So they will be working on that. And we have several of those throughout the district, and then lots of commercial providers and healthcare providers that will also be able to provide the vaccine. And then of course, public health will also be providing it. The vaccines are supposed to be free to the public, so everybody should have access to the vaccine once they start rolling out.
And for weeks, we've been telling you that public health folks are concerned about COVID colliding with the flu season. It's been a slow starting flu season, likely because we've been taking COVID precautions.
We haven't seen a lot of flu activity quite yet, so let's knock on wood. Remember, all the things that we do for COVID-19 to prevent it is also what we do for flu, with one added benefit. So if you get your flu shot, you'll have some protection against the flu. So next Tuesday, it's November 10th from 8 to noon. We're going to be having a drive-through flu drive over at Jim Miller Park. It is intended for adults and for people who are uninsured or underinsured. We won't be doing, any crazy checks on that or anything like that, but that's the intention. So if you are afraid of getting the flu shot, you can't get access to one, please come through our flu drive and you can get one done. And you might get lucky enough that I'll be able to be the one that gives you your shot. So maybe Ross will come out and get a shot from me.
Well, we'll see how that turns out with the flu vaccine at least. But in the meantime, when it comes to COVID, at one point, you remember not too long ago, cases were declining and declining very rapidly. There was a reason for that, and Dr. Memark says we need to go back to that.
Everybody is very, very tired of this, and COVID fatigue is very real. But there's some simple things that we can do we know work. And so if we can just push just a little bit longer. We have vaccines that are coming out soon, right? It's not going to be a magic bullet, but it's going to be a big player in helping us to control this virus and finally get back to normal life. So please wear your mask, make sure you keep your distance, and avoid any crowds. So that's a big thing we're seeing is socialization of athletic teams and parties, and washing your hands. These are all very important things. I'm going to share with you with the schools, you've seen some cases come in through the school system, right? But one of the things that I feel like, and I give kudos to every single one of our superintendents that have put mask mandates in, we have not seen transmission within the schools. And so it's not happening in the classroom, even though we find cases. And I really believe that it is because they're wearing masks that's adding some protection to them. So it's a simple thing. It's nothing that should be polarizing. It's something that we should just do to protect our community. So please wear your mask.